Hi, my name is Maddie, and I did my presentation on Lyme disease. So the history and emergence of Lyme disease in the 1970s, families in Lyme, Connecticut suffered from unexplained symptoms like swollen knees, paralysis, and fatigue with no diagnosis or treatment. Two mothers pushed for research, leading to the discovery of Lyme disease and its link to tick bites. In 1981, scientist Willy Bergdorfer discovered that Lyme is caused by a bacteria called Borrelia burgdorferi, which was carried by deer ticks or black-legged ticks. The discovery led to the use of antibiotics to treat Lyme disease, which is ineffective in early stages, but has been debated about its effectiveness for long-term use for advanced cases. And then today, since the 80s, Lyme disease cases have risen significantly and become a major public health issue in the US, and in 2012, the CDC listed it among the top 10 notifiable diseases. The CDC estimates that about 476,000 people are diagnosed with and treated for Lyme disease every year in the US. However, in 2022, only about 63,000 cases were reported. How does Lyme disease spread? Lyme disease is transmitted through bites from infected black-legged or deer ticks, mainly in the northeastern, mid-Atlantic, and north-central United States areas. Infection typically requires a tick to be attached for over 24 hours, and prompt removal reduces the risk of transmission. Bacteria are passed to humans, when ticks feed on infected rodents and deer, with nymphs being the highest risk because of their small size. And that's what a deer tick looks like. Route of exposure. The primary route of exposure is through outdoor activities in tick-prone areas, such as wooded or grassy environments. Humans are most at risk during late spring and summer months, with nymph ticks, which are smaller and harder to detect when they're most active. And here's a nymph tick in the tick lifespan. Impacts on the population, increasing incidence and geographic spread. Lyme disease has become the most commonly reported vector-borne disease in the United States, with both the number of cases and the areas affected growing over recent decades. Risk factors for infection. Risk factors such as increased exposure to tick habitats, limited knowledge about Lyme disease, and inconsistent use of personal protective measures contribute higher infection rates among the population. Implications for tourism management. The rise of Lyme disease poses more challenges for tourism, and immediate strategies to reduce risks for visitors and employees or people who live there, and ensure sustainable safety of the destinations. Policy changes over time, updating testing methods, the introduction of the modified two-tiered testing method, which they basically they test you for what they do one test, and then if that comes back negative, or positive, and or inconclusive, they do another test to solidify the results. And then that improved diagnostic sensitivity, reducing costs and turnaround time for Lyme disease detection. Insurance coverage mandates. Several states like Connecticut, Massachusetts, and Rhode Island enacted laws requiring insurance coverage for long-term antibiotic therapy for Lyme disease when deemed medically necessary by a physician. And again, there's been debates over the efficacy of long-term antibiotic therapy for advanced cases of Lyme disease. Establishment of treatment guidelines in 2006. The Infectious Diseases Association, or the IDSA, developed guidelines for diagnosing and treating Lyme disease, recommending against long-term antibiotic therapy due to the concerns about the efficacy and potential harm. Impacts on public health. Higher healthcare costs as Lyme disease becomes more common. It leads to higher healthcare costs for diagnosing and treating, and also managing long-term health problems. Necessity for public health education, effective prevention and control of Lyme disease requires ongoing public health campaigns to educate communities about risk factors, preventative measures, and the importance of early detection. Diagnostic challenges. The wide range of symptoms in Lyme disease can cause misdiagnoses or delays in treatment, leading to long-term health problems and extra pressure on healthcare resources. And then lastly, preventative measures. Using tick repellents. Apply insect repellents containing 20 or more DEET, D-E-E-T, which I believe is the chemical used in insect repellents, and you use that on exposed skin and clothing to deter ticks. You should wear protective clothing when outdoors in tick-infested areas. Wear long sleeve t-shirts or long sleeve shirts, long pants, and you should tuck your pants into your socks to minimize skin exposure. And then perform tick checks after outdoor activities. Thoroughly check your body and clothing for ticks, paying close attention to areas like the armpits, groin, and scalp. And then shower after outdoor activities. Shower within 2 hours of coming indoors to help remove ticks that may be on your body, reducing the risk of Lyme disease. All right, thank you.